I'm Erika Castellanos, Director of Programs at GATE, Global Actions for Trans Equality, and I am delighted to welcome you to AIDS 2020 Virtual. When we started to plan this conference, we never expected a new pandemic to force us into learning new technology, which is bringing us together in this new virtual platform. In many ways, this is going to be the most accessible gathering in the history of the International AIDS conferences. In recognition of these extraordinary times, registration to the IAS virtual COVID-19 conference that will take place on the last day of AIDS 2020 is completely free of charge. AIDS 2020 virtual completely eliminates the accessibility barriers that many of us as key populations had expressed. Meanwhile, it's time to work. It's time to work together. Let's strive together towards a future where no individual will have any concerns about attending an AIDS conference because of who we are. We need a world that respects and upholds the human rights of all. And the IAS plays a key role in making that happen at international AIDS conferences. AIDS 2020 Virtual Scholarship Program has enabled over 1,700 individuals from countries with low internet bandwidth to participate by removing the registration fee entirely and boosting participants' internet speed for easy access to all conference content and features. As always, the Global Village and Youth Program remain free and provides open access to the public. The International AIDS conferences have always provided a space for affected communities to interact directly with scientists and for policymakers to obtain evidence on new innovations in prevention, care, and treatment, and to connect with our global communities. While we will definitely miss the warmth and networking experiences that only an in-person conference can offer, AIDS 2020 Virtual offers us the opportunity to try new ways of connecting across our movements. Of course, for these connections to be meaningful, the information exchange must go both ways. I am here as much to share the experiences of my community as I am to gather the latest information. I am here because it is important to me as a transgender woman living with HIV, because we need to stop new HIV infections, because we need to stop AIDS-related deaths, and no one should experience stigma and discrimination as a result of our HIV status. I am here because I no longer want to hear the phrase, populations hard to reach. There is no such thing. There are only wrong approaches in trying to reach us. I am here because we, as a community, make a difference. I look forward to connecting with you all this week. Welcome to AIDS 2020. It is my pleasure to hand you over to International Broadcaster James Chau, who sat down with Sir Elton John and David Furnish for the fourth and final session of the AIDS 2020 virtual opening series on the Red Sofa. Welcome.
Hi Elton, hi David, welcome to AIDS 2020 Virtual, and thanks for joining us for On the Red Sofa, where we ask people, what's it going to take to truly end AIDS? Well, I'm thrilled to hear your insights from your long work with the Elton John AIDS Foundation and beyond to prevent infection, to fight stigma, and to provide treatment with love, compassion, and dignity for millions of people impacted by HIV globally. So let's jump in like this by going back to the early 1990s when the Elton John AIDS Foundation was created. At that time, a lot of your work was focused on caring for people towards the end of their lives. Almost 30 years later, who do you see as the key populations today? And I also want to ask, are we reaching them and are we caring for them?
Well, James, you're quite right in saying 30 years ago, the scenario was very bleak. And now, 30 years on, we have medicines available where we can actually stop the entire spread of AIDS if people get access to the medicines and they get educated about taking them. What we're finding is that 54% of new infections of HIV are among marginalized people. That's to say, transgender people, drug users, intravenous drug users, sex workers and their partners, and gay men. So it's very frightening to see this statistic because our motto has always been at the Elton John AIDS Foundation that no one gets left behind. So, we need to concentrate on this group of people, and that's what we're trying to do. And that's, that's really, really important. We're concentrating on that, especially in the South in America, amongst young gay black men. And it's really imperative that these people are given attention to. And I think that's what we're trying to do most of all within our foundation at the present time.
Let's look at what we learned from the journey of HIV/AIDS since it first appeared in the 80s. It was among one of the most marginalized groups of the population, being gay men and IV drug users. And a lot of people turned a blind eye. They made some moral judgments, some religious judgments, turned their back on people that needed compassion and care. And HIV/AIDS went on to become the biggest disease affecting our planet, infecting over 75 million people. Here we are, we find ourselves in 2020. We still have 54% of new infections amongst this marginalized group, and adding transgender people into it and sex workers. And we know the only way to defeat this disease and end it is to put our arms around everybody and make sure that no one gets left behind. So we will continue to fight for the marginalized, the disenfranchised, the people who life is already dealing them a difficult hand. They're already struggling with issues for a whole series of different reasons. We have to make sure that they get access to clear information, compassion, and access to treatment.
And what also we're finding is that the disease is changing. I remember we were in Durban for the AIDS conference many years ago. How many years ago is that? 4 years ago?
4 years ago.
And Nelson Mandela's grandson said to us, you have to get to the young people of sub-Saharan Africa because they don't listen. They don't think of HIV as a threat. They're not being told it's a threat. They're not being educated.
I think the thing that upsets us the most is that it's all preventable. 30 years ago, it wasn't as easily preventable. The medications weren't as effective as they are right now. And to see a young group who's highly vulnerable to contracting the virus, not being given the right information, not being given the right access to testing and treatment, and a series of barriers being in place, stopping them from getting that. And governments not necessarily being completely straightforward in their approach. And the conversations they need to have about sexual health, because it's a big part of life. But again, moral judgments get made, and it's an area that people push to one side. And what happens is HIV finds its way in.
Well, you brought up many aspects and nuances of stigma, which continues to be this huge barrier to all of us achieving the full, happy and healthy lives that is out there for us to touch and to reach. But how has stigma evolved in the times of your work? Because it spans such an important part of modern history and through AIDS. And have those changes brought up the same challenges time and time again?
In so many respects, particularly stigma in relation to homophobia, it hasn't moved on nearly as quickly as the science and medicine has moved on. We continue to see over and over again, any part of the world where LGBT people are criminalized or heavily discriminated against, we always see a rise in new HIV infections within those parts of the world, because people still so strongly associate HIV with being gay and being a gay disease and a disease that you die of. And these are big barriers that don't go away overnight. And when governments reinforce prejudice, when people in the health service reinforce prejudice, you're setting up some major barriers that stop people from wanting to go and get an HIV test, from wanting to identify as being HIV positive, from wanting to go and pick up their medication and stay on their medication. If you're in a country where it's criminalized, it's utterly terrifying, because you think the minute you're diagnosed with HIV, people are going to automatically assume you're gay, and then you're doing something that's against the law. So that stigma spreads across the entire disease, and mixed with the notion that HIV is a disease that you die from, as opposed to a disease that you live a long, full life with. We need to do a lot more work there as well. Elton and I woke up this morning and read an interview with Gareth Thomas, the British rugby player, openly gay and now openly HIV positive. And Gareth, who lives in the Western world, works within the sports industry, very well educated, very well connected, he still said, I thought if you contract HIV, you die. And that's just one example of the misinformation that's out there today, that people don't realize how easy it is to manage this disease now and how people live long, full lives.
If you instill fear into people as well as shame, that cocktail is a very heady mix. So if you're living in a country in Africa, where it's against the law to be gay, and you instill this fear of being tested and then being told you're HIV positive, it's just a double whammy. And it's cruel and it's evil and it's completely unnecessary. And that's why people are loath to get tested, because
they're scared. They're frightened.
They're scared. And if they find out they're HIV, they're going to be disowned by their families still in this day and age. And we're living in the 2020 now. We haven't really moved on as far as stigma goes. Stigma is still our biggest nightmare, and it's our biggest. It's like having the barricades brought up. Not only just in Africa, in Southern America, in the poor rural South, we see stigma all the time, and we've been helping people in the South in America for a long time. We went down to Atlanta last year. We had meetings with people there. The stigma is that 9 people in Atlanta died of AIDS last year. People are dying of AIDS. This is crazy. But it's because they're frightened. They're scared. Their church will disown them. Their family will disown them. So they don't bother to get tested because they're scared. And the fear of having HIV and getting it and then having to face your families and your peers is an incredible amount of pressure. And it makes me so angry.
And it's sad because it doesn't match the science. When the news about treatment and prevention is so great, where having an undetectable viral load means you're completely untransmissible, that you can't pass the virus on to someone else, that not only taking a pill a day keeps you alive and you live a full uncomplicated life, but you don't pass the disease on to anyone else. So treatment is prevention. If everybody in the world was not frightened of having an AIDS test, everybody knew their HIV status, and everybody had access to treatment, there'd be no new HIV infections in the world today.
I feel your anger. You, not only as a foundation, but you as individuals, are working in the cities, in the countries, in the communities that are experiencing many of the deepest HIV epidemics in the world today. What do you think is going to take to create a fundamental shift in those areas?
I think the most important thing is consistency of effort. I think that when you get involved with HIV/AIDS and you start educating people, that you keep the communication up, this disease doesn't go away. People have to manage their disease on a daily basis. So all of the efforts that we put in, I think, have to be done on a consistent basis. I think there's a danger that people will look at the progress that's been made today. They don't see as many people sick and dying in the world that they used to, and they think, oh, we've dealt with that, we can move on. Well, this is where we see rises in new infections. Decriminalization of LGBT issues. It's great to see what just happened in America in the Supreme Court, where they made it illegal for someone to discriminate against someone in the workplace based on their sexuality. Those types of things are real steps in the right direction. But then you have to counter that with another decision that was made to remove protections in healthcare for trans people within society. That sets us backwards, and that makes it more frightening for people within the trans community to compassionately seek the healthcare that they need and they deserve. So on a government level, on a policy level, we have to do as much as we can to decriminalize sexuality in our society. Super important. And again, access to health care, medications, tests. We don't live in an equal world, and a lot of people can't afford to get access to healthcare. So we need to continue to invest in global healthcare systems that allow people to get the care they need.
Also, I believe dialogue. I mean, I say I'm angry, and I am angry. We're all angry about the fact that this disease is still rampaging on. But certain countries have different ideas about, they have different religious ideas or whatever. You have to have a dialogue. You just can't go in and say, you must do this, you must do that. So you go 2 steps forward and 1 step back. But you have to keep doing it. If you don't put your foot in the water, then you're never going to get anywhere. And, as much as I'd love this to all end tomorrow, it's just unreasonable to think it's going to, because you're dealing with people who have different opinions from yours, and you're going to have to convince them by dialogue and through keep saying, listen, come on, this is a no-brainer. This is going to help you economically. This is not humane what you're doing, but you're going to have to convince people. And so the dialogue is really, really essential, and especially when you're dealing with countries in the old Soviet part of Europe, in the Far East, and of course in Africa.
There's a lot of homophobia, a lot of heavily entrenched homophobic points of view, and we really need, again, going back to consistency and dialogue and presence, we have to continue to break down those barriers and break down those walls.
I have seen you both, Elton in particular, working with people, not just participating in dialogues, but actually creating those opportunities as well. Obviously, both of you have unique experiences over decades in solidarity with the global AIDS family. Looking now at the situation we find ourselves in today, where the world is brought to its knees by COVID-19, when you think about COVID-19, when you think about AIDS, when you think about all the moments that you've been a part of, what can be repurposed for the COVID-19 response? And in a world where the settings are very different to the one that came before.
You think you have HIV, you can go get a test and you can know your status. That's not a problem. But if it's harder to get a COVID test than it is an HIV test. What we're finding is because of the horrifying scenario of the COVID situation, which it seems to be relentless all over the place. And in fact, last week was the biggest increase of infections that the WHO had seen. So this is not going away. And we have to make sure that the attention is not shifted away from our HIV focus, because we have to make sure that we keep our foot on the accelerator. We set up an emergency fund with the Elton John AIDS Foundation, a COVID-19 emergency fund, and it's dispersed over $1 million to people in 43 organizations, because one pandemic and another pandemic comes along, but a lot of people have died through AIDS, and a lot of people have died through coronavirus, but the statistics aren't even close. We can't afford to take our foot off the accelerator as far as the HIV thing. And I think people are afraid of getting tested for COVID, but they're also afraid of getting tested for HIV. But it's easy to get the HIV test done. And it's knowing your status is the biggest advantage you can have for HIV. Knowing your status so you can get treated. But people are afraid to get the status. And look, in America, in the Deep South, we're seeing a huge rise. But this statistic, 1 in every 2 Black gay Americans will contract HIV in their lifetime. That is terrifying. That is, that's a statistic that we are not proud of.
It's also not a surprise to us to see that the marginalized communities where HIV disproportionately impacts people, a lot of those same people are being impacted by COVID. And that brings us full circle back to access to healthcare, access to testing, access to treatment. What we're trying to do with our COVID-19 emergency fund is to make sure that we don't lose the momentum that we have, that we continue the consistency that's so important. People have to continue to get access to their treatment. They have to continue to get access to medicines and to testing. And in a world where people are more isolated in their homes and locked away, we're going into a healthcare facility now has a whole other level of fear associated with it, which is I may contract COVID, I might get sick. It means people are less likely than ever to seek out healthcare. So we're taking our efforts, we're moving a lot of the work that we do online in terms of the diagnosis and the follow-up and the counseling that's required to keep people on their medications. We're providing PPE equipment for people that work in the clinic so they can go out into the field, visit people in their homes, or where they work in a clinic and people are still coming, they can protect themselves. We're delivering medicines now in a mobile capacity, again, because people can't go and pick them up, or there's greater risks associated with picking them up. You can't start a treatment of HIV medication and stop it and start it and stop it. You have to be consistent with it. The best results that we get are when people test early, we detect their HIV right away, and they start treatment and they stay on treatment consistently. Those are the people that always have the best results on the medication. If you suddenly stop taking your HIV medication, the viral load goes up, and that's when your immune system becomes hugely compromised, and you fall prey to a whole series of other opportunistic infections. And that becomes a very, very complicated, often fatal mix.
As we wrap up our time together, I wonder whether we can finish off like this, because I just have this very strong feeling that many of the terrified, scared, anxious young people whom you've talked about throughout this interview may be watching this right now. If they're scared because of their sexuality, because of their status, because of the rejection by their family, by their parents, for example, what do you have to say to them now?
Finding out your status is the most important thing. You must find out. Then you know where you stand, and you can get treatment, and you can live a full life. That is the wonderful thing. This is not a death sentence. This is something that is treatable. And that is the wonderful news. The bad news is the stigma, obviously. But please don't be afraid. People like our organizations will put our arm around you. We need, people need the love. I've been going on this for years. People need this love, and they need compassion. The bedside manner of our organization and many other organizations is so important. People need to know that they're cared about. They don't need to feel scared. A lot of organizations will greet you with open arms. Do not be afraid. Fear is a killer. Do not be afraid of this. If, it's your life. Your destiny is in your own hands, and you can get tested. You can find out your status. If you are HIV positive, you go on medicine.
Recognize that you're not alone. You are part of a global community of 37 million people who are living with HIV today. There's a whole army of people out there who are living the fullest, happiest lives with this disease. And I would say initially seek support where you're living, get in contact with local HIV organizations. A lot of connecting we can do up now via the internet. You can get involved with chat groups, Zoom groups, ways of feeling the love and the support of other people who are dealing with exactly the same issues that you're dealing with. There's a whole network of people out there living with HIV, and we make it a big part of what we do to fund the organizations that support those people who are living with HIV. So seek them out, find them, and get the support that you deserve. You are not alone. You don't have to deal with this by yourself. There's a whole group of people out there, an army of people out there who can help you.
There's an organization formed in the early, about 1930s in America called Alcoholics Anonymous. This organization's mushroomed into a worldwide organization of help, of helplines, of a brotherhood, a fellowship. That organization and fellowship applies to people who are HIV positive. There are helplines everywhere. There are organizations and meetings for HIV positive people in every city. Use those. Use your fellowship, use your brotherhood, and don't feel that you're alone anymore.
Whatever you do, don't isolate. Isolation only stokes fear, only stokes loneliness and a sense of hopelessness. As we said at the beginning of our talk with you, the science, the medical news is so great. It's so positive. There's nothing to fear with HIV now. There's nothing to fear about living with this disease and managing it medically. The only thing you really have to fear is fear itself, and get support to help you overcome that, and to allow yourself to move into a way of life where you can embrace your disease and you can embrace living with it in a very positive way.
And be proud of who you are. Be proud of who you are. Never be ashamed of being HIV positive. It's just another disease that's very treatable, and you don't have to die. But be proud, be honest. The more honest you get, the freer you become.
Yeah.
Elton and David, it's an honor speaking with you both. And I think on behalf of all humanity, thank you for your leadership and thank you for your love.
Thank you, James.
Thank
It's
you,
lovely
James.
to talk
Thanks
to you.
for your support and commitment as well.